Hi everyone, we're at Beacon. So I'm Matthew, this is CC, Zul. Oh, weekend I thought his name was Z. Zul, Josh and me. So we built an ecosystem with a few different ways of getting data into the web. We'll talk more about that in a few minutes, but CC will give us more of a rundown on how we got there. So the team is myself, CC, Josh, Z, and Naveen.
Next slide.
Yes,
Okay.
take it away.
Yeah, okay. So as you can see, we're talking about medical equipment. So I guess looking at what's happening in the world, we saw that there is some major loss in the US, $11 million. And then in UK, there's over $1 billion in medical equipment being lost, and they're talking about 23 days that's lost by nurses looking for missing equipment in hospitals. Unfortunately, I can't find any data from Australian perspective. It could either be that Australian hospitals are extremely well managed, which I would say that Jason is not agreeing to that, or alternatively, they haven't been reported widely. So it's still a problem. It's not an issue. So a number of people, we give you some examples. Have everyone been into hospital, medical, or emergency departments? Have you been waiting there for like 4 hours without being seen? So this David here is pretty unfortunate. Had an accident, broken his ankle, but the nurses couldn't find any brace, so he was just waiting there, extremely in pain. One example. And then we've got the nurse. Nurse, she is extremely very diligent, but she still can't find a lot of equipment. And she spends a lot of time, as I was saying earlier, in the UK. They're saying 23 days in their working life they're looking for equipment. And they're responsible for anything that's missing as well. So they need to report on the condition of the equipment and whether it's, everything is there so that they plan the day, etc. Then the surgeons, we've got John and Jen. And they need all the equipment ready, and sometimes they can't find the equipment and they get really frustrated. They can't really perform well in the operating theatre, and that's an event of life or death. So in some serious incidences, then obviously they rely on nurses to look after them to get everything ready. And then we've got the hospital administrator. And obviously, they have the responsibility for the running of the entire hospital, for the safety and conditions of the assets, as well as minimizing losses in terms of the profit of the organization. So they're relying on all the medical staff and also relying on the administration staff to make it happen. So as I was saying, these are all the problems that we have in hospitals in relation to assets. And now we're going on to Josh to talk about what are the potential solutions.
Thank you. So some of the tech that we could use to help solve the asset tracking, it could range from really cheap, really simple, like a QR code or an NFC tag, and then go to quite complex, where you're having IoT devices or Bluetooth beacons on all of your valuable assets, and then setting up a network so you can know instantly where your assets are across your hospital. This isn't just for hospitals as well, it can also translate into aged care facilities and this sort of thing. So we've gone with the cheaper ones to the most expensive ones, as you can see here. So we think that QR code is a really practical, quick, cheap, simple way, low risk, to be able to track and report assets, where their state, their logs, that sort of thing. Whereas if you had a GPS system, a battery-powered GPS system or an IoT device on all of your assets, that's quite a big network. That's a lot of hardware infrastructure, massive cost to implement. So going back one, so QR code, and then so also the Bluetooth beacons. So this still is a practical solution. And we've all seen those tile icons where you can find your keys because you've got a Bluetooth beacon on your keys. So you could do a similar approach to all of your assets across an aged care facility or hospital or something like that. So how does it work? For example, you can see here, this is an expensive medical device, looks like an ultrasound, and it's got a QR code. So here you can quickly check, say that it's that there's a malfunction, you need to report a log, and something like that. And then you go to the Bluetooth approach where you can have a Bluetooth beacon on that device, because if the device is missing, the QR code is no good because you can't stand it and you can't report it, right? Because there's no QR code. So that's where the Bluetooth comes in. So there's a level 1 stage and a level 2 stage as well. So how does the Bluetooth beacon work? You can see here, this is a room. You can see here that it has Bluetooth beacons around the room and then a central cloud beacon, which reports the location of all the Bluetooth beacons. And obviously it's accessible via a web panel. Another really useful application is to have a QR code on the door. So staff can actually, so the hospital staff need to log who they've seen throughout the day and what they've done. And apparently this takes a lot of time to do. So if you had a phone where you could just scan, you can pre-fill the form of the customer and quickly do all your logging for the day. And I think we have a demo.
So tested that with your sister who's in the hospital.
Yeah, that's right. So here is the demo. So you can have QR codes all over the hospital, and if you need to report something, you can just scan it. And that opens a fast report tool, so it's really quick to report things missing or things need checking. And then this can obviously send an SMS or an email to the cleaner. So I've submitted that on my phone. And then this is a web dash panel where you can see reporting hazards around the hospital, or missing items or something like that.
Is that real time?
Yes.
So that's 4 o'clock this morning?
Let's go down. Maybe it's GMT.
Just checking.
Yeah, I think it's UTC time.
Back to the slide.
Back to the
It's good
slide.
that you're listening, you're paying attention. All right, so as I was earlier introduced as a numbers person, so I'll just talk about a little bit about how does the finance work in terms of this. So in terms of the cost, there's really minimal cost for the QR code itself. And what's more, what will cost more is about the development of the monitoring system, uploading the data, the actual customer interface. We've got to design that. The demo is already designed. Over the last 24 hours, basically designed a little demo of that very quick system, so it can be done in a relatively quick space as well. And then we have the implementation costs at hospitals or the aged care facility, which could be more substantial because it'll mean that you're actually applying QR codes to all the assets or whatever you decide which level of asset you want to apply it to. But that is, it will be weighed against what benefit it's actually getting the hospitals in terms of, not missing the equipment, getting the equipment reported straight away when there is, anything wrong with it, or, all those sort of things. And obviously there's training costs for employees, there's ongoing application maintenance costs, and then the data management as well. So we thinking about, this is not a free thing that we're managing, so we're going to, some ideas about business model in terms of what revenue we're going to get. Obviously, you can do a once in a while initial setup revenue only, and the client can manage it themselves. So they do the management of all the data and everything. And the second level is we will do a weekly monitoring of their assets, and we do initial setup revenue and then ongoing cost for maintenance, subscription, and then there is a co-op fee for any specific things that we need to help them with. And the third level is actually it's going to be daily monitoring, a lot of intense help, but then in that case they pay a larger monthly subscription fee, but they don't have to pay a call-out fee. So in terms of competitors, these are actually competitors that are in the US or in Canada that are in the space of more the beacons and the domestic or the indoor location systems. So they're not specifically on the QR code one, and we haven't really found anything that's sort of competing with that. Although there are ones in Australia that they're doing something similar but not the same. Steps forward, obviously we need to build a prototype, we need to do field testing, improve the design, market testing, early client adoption, all of those things. So that's all. We get some supporting slides as well if you have any other questions.